Staying healthy is not easy for any of us. We have an infinite amount of information about what we should and shouldn't do, a finite attention span, and a difficult time in changing unhealthy behaviors that give us a positive reward. Staying healthy for people who have experienced toxic stress is even more challenging. Lynn, male, is from the east side. His apartment is near the train station and there are police lights in his windows most of the time. Last week, a young girl was mistakenly shot while walking to school. The girl was a friend of Lynn's granddaughter. Assaults and robberies are something that happen daily. Lynn's hypertension is out of control. His doctor makes a strong, impassioned plea for Lynn to eat better and take his medications. Only Lynn isn't listening. He's thinking that the young girl that died could have been his granddaughter. Both end the appointment frustrated. Lynn is scared and hypervigilant, and his doctor is feeling at wit's end in trying to help him avoid another stroke. The doctor and patient did not talk about what is at the root of Lynn's poor health outcome. A potentially life-saving conversation never happened. Olivia, female, was in a horrific car accident when she was in college. She broke 20 bones, was resuscitated twice, and spent months recovering. She breaks down one day at work, fearing that she will lose her job as a flight attendant because she's drinking vodka daily since the accident. Olivia tells her coworker, "The only thing that helps me get through the day is drinking. It takes the edge off my pain and anxiety after the accident. I've been to my doctor a lot lately with stomach problems. She tells me I have to stop drinking. I can't give it up. How am I supposed to work?" Debbie, female, has a diagnosis of schizophrenia and was hospitalized in the state psychiatric hospital while growing up. She's lived in her own apartment for the past 35 years. She's not been able to work consistently because her diabetes is rarely under control. She likes her ACT team, but doesn't trust most doctors or healthcare providers. Something is missing: emotional dimensions of healthcare. What is emotional dimensions of healthcare? In the face of toxic stress, many people develop compensatory mechanisms to help them get through the day. The problem comes in when these compensatory mechanisms are used in excess or for a duration that triggers what we call health-interfering behaviors. Over time, health-interfering behaviors lead to chronic disease, suffering, and early death. We can prevent chronic disease or lessen its impact by talking with our patients about stress and health-interfering behaviors, using motivational interviewing techniques to enhance commitment to change, encouraging the use of tools or apps to help track health-interfering behaviors, which build awareness of triggers and set the stage for developing adaptive coping strategies. We can offer real solutions through the replacement of health-interfering behaviors with health-promoting behaviors. These include mindfulness, distress tolerance, cognitive restructuring, peer support, and emotional regulation. We can put this entire process into action with an EDH coping plan. How would EDH impact Lynn, Olivia, and Debbie? Lynn goes to his primary care doctor who was just trained in What Matters to You from the Institute for Health Improvement. Together, they talk through Lynn's recent lab work and home blood pressure monitoring results. The doctor says to Lynn, "We're really struggling with getting your blood pressure to a level that will make you feel better. Help me understand what's most important to you, Lynn, as we try to figure this out." Lynn says, "Safety, doc. I've lived in my house for 20 years, but I don't feel safe anymore, and I sure don't want my granddaughter to be the next one to get shot. I'm just sick about it because I can't afford to move either." The doctor makes a referral to Helping Hands, a service from a local church that does free home safety inspections and installs new locks and lighting for seniors. Through this group, Lynn found out about the Neighborhood Watch Group, which he joined. They gave him great advice for staying safe and numbers to call if he felt unsafe. The doctor also referred Lynn to a local mindfulness meditation class. He was reluctant to go at first, but after some continued coaching, he tried it and is up to meditating for 15 minutes a day. Lynn's blood pressure has been under control for the first time in 5 years. Olivia goes to a new rural health hub in the nearest town. While waiting for the nurse practitioner, she watches a video by Cigna showing Queen Latifah talking about stress. In the assessment process, they ask her about mind and body. When learning about her car accident, they ask her how she's doing emotionally. She shares how she just can't keep up with the aches, pains, and anxiety, and tearfully that she may lose her job. The health hub completes her physical, addresses her physical pain, and walks her to a nearby suite of offices where she joins a 12-session CBT class. After 6 months, Olivia's lost 10 pounds and is starting a Tai Chi video series that she can take with her on her trips as a flight attendant. Frustrated by their collective inability to help Debbie effectively manage her diabetes, her ACT psychiatrist and her primary care doctor talk about what's driving her behavior. She doesn't like going to the hospital, and while she has cut back, sweets are her one pleasure in life. They both acknowledge Dr. Phillips, the ACT psychiatrist, is the only trusted person in Debbie's life. The primary care doctor says, "Hey, how about I read Debbie's labs, prescribe a new long-acting diabetes medication, and you, Dr. Phillips, give her the injection when she comes in to see you." It worked. How do we encourage more people? How do we learn to see, sit with, and act on people's emotional dimensions of health? We take the first step. We tell others. We start a movement. EmotionalDimensionsOfHealthcare.com